Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com. Today we're going to talk about posterior bite turbos, posterior bite bumps, bite.me, whatever you want to call these things. Glue that goes on back teeth. Canines are, I don't know if you want to call these back teeth. I still call that, it's not really a posterior, but it is. Glue that goes on back teeth in either braces. It's not really talking about aligners. I want to talk more about braces because aligners, it's baked into the tray. So it's really a different situation than braces. So that goes on teeth with the point to open a bite. Okay. So you guys have all seen this. Usually it's blue, but you can make it white. You can roll it up. You can use key tack. You can use IRM. You can use, what else have we used? Goodness. I mean, you can just use composite. You can add some articulation shavings to your composite and stir it around so it turns blue. Transbond's already blue, whatever. Who cares what you make them out of? You layer them, you put them on, boom, now we're not hitting brackets, right? This is pretty old school stuff, okay? The main thing, and I have a lot of content on these already on terms of when and why you use them. I'm going to talk more about being careful when you use them and things to look out for and dangers that can happen and what to look, and how long is too long to leave them on for. And so let's talk about that. Okay, so first of all, what happens in a braces case? Because an aligner case is different because the forces are all distributed. There, it's like a tray, right? So it's the same but different, less likely to have trauma. What happens when you load a bunch of composite on a tooth, right? Now all the pressure is going on that tooth when they bite down, all the mask joint pressure. People have different pressures, but that adds extra forces to that tooth. Now, first of all, please don't just do it on one tooth. That's rude and cruel, okay? That hurts the patient. If you've ever had bite bumps, and I had them, they suck, okay? So everybody hates them. And to be honest, this should not be ever part of your plan. This never needs to be part of your plan. This is a sloppy way to do plans. If this is on most of your cases, you are a sloppy dentist or orthodontist, and I'm going to tell you flat out, your mechanics are bad. And I'm pretty blunt in my videos when I need to be because it wakes a lot of people up. Like, oh my God, am I sloppy? Yeah, everybody, trust me. Even if that's the way you were taught, anyone that sees your cases, including patients, they know now. I think the fun thing about TikTok and all the stuff that's out there now, and I have teenagers, soon to have not a teenager, soon to have a 20-year-old, but you know, they're very much more aware of what things are high quality and low quality because people talk about it. Now, it doesn't mean these are educated people, but it's just common perception. So this is perceived sloppy dentistry, which I'm so glad now finally the public knows this is sloppy dentistry. But okay, anyways, there are times you do legitimately have to put them on as an emergency and the patient will understand. But if all in all, if you do really good treatment planning, these should never have to go on. But anyways, that being said, all the forces go on it. It can cause root resorption, root damage, PDL issues, tooth loss. I mean, I've seen a lot of stuff happen from leaving these suckers either too high, not picking the right tooth to put them on, or leaving them on too long. I tell you guys, when you put these on, you now have a liability. Anytime you put these on, you better babysit that kid. So you guys who are doing mechanics that include stuff that is temporarily risky, I'm not saying this is risky for 1 month. It's probably not, assuming you pick the right tooth and you do the right mechanics and there was the right reason to do it. But too many of you are leaving them on for months, years. Well, and you forget about them. That's the problem. The second one of these suckers goes on, you need to have a pop-up in your chart that says, bite bump went on, bite bump must be off by this date. Countdown widget. I used to put all, I laugh because just in case on my old assistants, when I was really in my crazy ortho days working, 5 days a week, 80 patients, 90 patients a day, whatever burnt me out, right? But got me a lot of experience. So fun. I'm way too old for that now. I had pop-ups out the wazoo. Like, and this was, I mean, a lot of this started before computers and now it's so much easier. But like even in charts, I had like stickers and warnings and there's all these stuff that before we could use computers to run reports. So, I mean, you can run reports. There's a lot of things you can do. Do not leave these on. I mean, if you put one of these on, you better be checking it every month. And if the patient misses their appointment, you are on the call. You're on the phone. They are coming in. I don't care if they went to a different country. We got a problem now. Okay. So anyone that gets these on can't disappear. Like you have to let them know you're going to be their biggest friend for the, you can say it in a nice way, but you and I got to know where you are. Even if you go out of town for a few months, I got to know, this kind of stuff. I'm not saying it's like that, but I'm saying you can't lose your patient, because if you forgot that you left them on and they stay on a long, long, long time. Now, remember, your patients should be coming in, if they have braces, they're coming in every month. But sometimes people are putting these on retention cases and phase one cases and other stuff that where they're holding. And even sometimes in your braces cases, you're holding for a period of time. Okay. Patient has to come in at least every 4 weeks if they have these suckers on. So you can check the tooth. You can make sure the tooth is okay. If they have to be on more than 2 to 3 months, then you better have more than two on. You need to distribute the forces. In Invisalign, if I put them on, they're either on 7 through 10 for a deeper bite situation, or they're on all the back teeth for a situation where we're trying to intrude teeth, or we're trying to jump a bite or cross bite or something. You know, we're stabilizing all the forces. That's much less risky. But too many of you guys are just doing one or two. Dangerous, risky, sloppy. Okay. Have I done it? Yes, but it's always just for one, a few weeks. That's it, and then it comes off. So when would I use these? Now I told you guys it's sloppy orthodontics, whatever. There's a few times when I would. Okay, so the alternative is something called a gelb or a gelb. I don't know. I've heard it called both different ways. GELB. You can go into my YouTube channel, put in the keyword gelb or gelb. In German, it's pronounced gelb, so that's the color yellow. These are little posterior bite appliances. They do the same thing. They're just removable, healthy, and safe. But yes, they cost money. They have to be made. And you can't really be using these if you're doing lower movement same time. So a gelb is used in a situation where you're trying to do upper movements, but they're colliding with the lower, and you're trying to like either fix an anterior crossbite or something where they're hitting, and you need to prop the bite open temporarily. That's when you use a gelb. Totally cool with that. Now, have I used posterior bite bumps in replacement when I wanted to use a gelb? Yeah, because some patients refuse to wear a gelb. They're just not going to wear it. It's removable. If they're not going to wear it, more damage is going to happen and all the brackets are going to break. So then if they refuse to wear it, then they're going to get bite bumps and it's not going to be fun. But I'm going to be their freaking best friend for until they're off. I need to know where they are. They have to check in. If they even miss an appointment, I'm going to be all over them. I'm calling them. I'll be texting them. They got to realize that if they reschedule or miss an appointment, they got to go in virtual. Like there's going to be a lot of rules. So that's how you deal with this kind of stuff, right? If you do it like that, and you as a doctor should be able to list on one hand how many people have posterior bite bumps. That's how I want you to do it. And then I want you to know when they're off and then celebrate it when they come off. And if you do it like that, then it's fine. Just an aside, like because of what I do and my channel is really focused towards dentists. Ultimately, I think y'all know that I do this just to give back to the community. All of this is, I do appreciate it if you guys purchase a class or something from me, or a document from me. It really helps support my family. But in any case, I do this just to get the word out about good orthodontics, and ideally to help to change the culture of orthodontics, to make it more inclusive and to not gatekeep the really important information, so that the primary care dentists, and even, it's okay if consumers hear it, they should know what's out there. And then they can take it to their dentist. But it's not for anyone to do DIY stuff. But anyways, that being said, with this whole very long video about bite bumps, my goal is just to get good information out there. I do have consulting, to help supplement my income. I work with doctors one-on-one, and I really appreciate when you guys do, contact me for that support. It's really nice. But thank you so much, for listening to my videos. Anything you can do to spread them, share them, much appreciative. And if you ever have a case, I would love to take a look. But I think this is awesome that you guys are excited to learn more about the risks. Thank you.